I'm Julia Fung. By day, I'm a pediatric urgent care physician with the Palo Alto Medical Foundation in Fremont, California. And as Dimitha mentioned, I've partnered with a program called Take Pause that I'm implementing across PAMP. And I'm here hoping to give you a perspective of what it's like to introduce an innovative startup program into a large, sometimes bureaucratic organization. I'm here joined also with our PAMP Research Institute colleagues, Cheryl Stoltz and Katie Gillespie. So first, I want to start with the story of why I care about this program. This is my son, Ethan. He's 8 years old in this picture, and as you can see, he is adorable. And when the COVID vaccine came out, we scheduled it right away. We went to this vaccine center in a large auditorium with lots of people and noise. This was really stressful for Ethan, and he had a really hard time getting his mind and body ready for the vaccine. So after an hour of trying to talk him through it, two grown men and myself held him down and gave him the shot. And after that day, Ethan developed a significant fear of needles. He wasn't able to get his flu shot. He wasn't able to get dental work done. And he also feels really badly about himself that he can't do it. So looking at the situation as a pediatrician, I learned that how we treat our patients can have lasting effects, in this case, in a negative way. I think it's important to do better in this area, and I was looking for an innovative way to do it. So this is a picture of Ethan about a year later using Take Pause at a flu vaccine appointment. He put a headset on, picked a butterfly as his avatar, and entered an immersive starry sky environment. A calming voice guided him to match his breathing to the movement of his butterfly's wings. As I was sitting next to him, I observed a transformation of his whole body. His breathing slowed, his arms and legs relaxed, and his posture softened. When he took off the headset, he was a different kid. He was calm, present, and engaged. So Take Pause is a program that uses virtual reality to teach mindfulness techniques. There is evidence that this program decreases anxiety and pain in children and adults. There's also evidence that mindfulness practice in general decreases anxiety long-term. The idea is to use a clinic visit as an opportunity to teach patients a calming skill to use in the moment and in future situations. So we currently use this program with patients across our pediatric urgent care clinics in PAMP. We have 5 locations altogether for patients with pain and anxiety. We implement a workflow that empowers clinical staff to identify candidates and educate families. And patients do the Take Pause while waiting to be seen by the clinician, before a painful experience like a blood draw, or even during a painful procedure like getting stitches placed. So far, Take Pause has been used at PAMP more than 500 times. We've partnered with the organization's Research Institute to gather data on how Take Pause is impacting patients. So this is a snapshot of recent data from one of our clinics that I present to our leaders periodically. To measure the impact on anxiety, patients are asked to rate their anxiety before and after the session. Of the ones that completed the rating, 70% of them report a decrease in their anxiety. We also noticed that the patients coming in with the highest levels of anxiety and patients spending more time in the session experienced greater relief.
Dr. Fung,
yeah.
Can I just interrupt briefly? We love seeing your avatar, your actual self in the bottom right, but you're blocking the last one. We just want to be able to see that. Yeah. But if you want, yeah, there you go. And you can also, if you want, as much as we love it, if it's easier to show the data, you can turn off that function and we can still see you in the speaker window, but we'll add a little onto your time because of that.
Why don't I just share it the old-fashioned way then? Let me see.
Okay. But love the tech initiative though.
It might, let me just move because I have to like pull up the slides and that might take some time. So I'll just move.
Absolutely.
Okay. So great. Also to measure impact on the family's experience, we invite parents to complete a survey that includes some identical questions to our clinic-wide patient satisfaction survey that we send out. Take Pause respondents scored more favorably and closer to our nationwide benchmark on 2 key questions. How likely were they to recommend this facility, the Net Promoter Score, and how well were they seen in a timely manner? So in our clinics, we really struggle with our patient satisfaction scores. So the bottom graph is our clinic-wide score, which is below our benchmark, which is that vertical gray line. And so our take pause respondents is the blue bar closer to our benchmark. So we're getting there. This data is so exciting to me because it shows that a quick, non-invasive intervention can provide a therapeutic benefit to our patients and measurably improve the family's experience. So virtual reality has been used to help patients in the healthcare context, but to my knowledge, had not been integrated in a clinic before. Building a new program with new technology in a large organization has its challenges. The privacy and information security team ensures that the headset's connectivity and data were secure. This took a really long time. It was very thorough with lots of steps. It took about 6 months. The invoicing and payment process, et cetera, is confusing and a bit opaque. That also takes a long time. So far, this is our biggest challenge and it's been our rate limiting step in expanding our program. It's a tall order to ask teams to integrate a new technology into their busy day. I have found the program to be most successful when there is a staff member and a clinician in the department that owns the process, provides feedback, and creates their own solutions. Without that, it's very difficult to get started. So it's taking a village to implement this program. Take Pause's founder, Dumitha has a passion for healing patients. This is evident in her thoughtfulness and reliability. We partner all the time. Strong local leaders like clinic managers create frontline engagement. Our PAMF research team does the crucial work of collecting and analyzing data to show proof of concept. Thanks to our Sutter media team, we have been featured in 2 newspapers and 2 television pieces so far. This informs the general public of our innovative service offering and helps garner support for expansion within our organization. And philanthropy has committed to fund pilots of this program in multiple settings. Following the pilot, each clinic can choose to fund this program long-term. So I want to pause because I want to show you that this slide is full of women and strong, compassionate, very, very leader-driven women. And so I'm really grateful to be part of this team. There's so many ways this program can improve health. I'll move to the side here. In addition to our pediatric urgent care clinics, we are expanding to general pediatrics, vaccine clinics, surgery centers, staff and clinician break rooms. I'm also starting to partner with primary care and our health education department to use Take Pause to treat hypertension. And the intention here is to measurably improve pain, anxiety, blood pressure, patient satisfaction, and joy of work. I'd like to end with a patient's story. So recently a child came into our pediatric urgent care clinic with an injury that needed a procedure. So this child did take pause while undergoing that painful procedure. After the visit, our research team interviewed the parent, and here is an excerpt. It was so cool because he got this is the parent's words. It was so cool because he got his headset on, his own world. Sometimes he really struggles with anxiety, particularly around any kind of ouchie. It's something he can get worked up about and he's scared of. He didn't even notice anything or say anything or do anything when the doctor did the procedure. She turned to me and whispered, "It's done." And he was off in his space. It was a great experience all the way around. So our team is passionate about helping people and we're excited about using innovation to do it. We are so grateful to have the opportunity to implement Take Pause in a variety of settings across PAMF. And we'd love to hear your questions, comments, suggestions, anything at all. Thank you.